Something that has been a very important issue for us is the need of more beds in assisted living. By that I mean places where people who don't have to be in hospital but who are incapable of living on their own in the community, even with a package of care, would live. Somewhere where they are housed, where they eat, where they're taken care of, where their medication is given to them as necessary. We feel there is a need for that. I'm not sure exactly how many people, but it is needed. We have been told by the minister within the last couple of years that yes, there was a commitment for that, but there needs to be more than a verbal commitment. We need to see that it's actually happening. But I think we need to work towards continuing to reduce waiting times. I don't know how exactly we do that if we don't invest more in it, but it needs to happen.
What are current waiting times?
I think about 27 weeks.
For our psychologists, the median waiting time at the moment is 28 weeks, which is way too much.
Mm-hmm.
But we've increased the number of psychologists. We have 7 psychologists. We have 3 counsellors. And in fact, the median waiting time 2 years ago was over 100 weeks.
Wow.
So there's a significant improvement, still way, way too long. But by looking at efficiencies and looking at the way that we're working, digitalizing is another way that we can do that. It's not as simple as just throwing extra psychologists at it. We may have to come to that, but there's been significant improvement. And if we maintain that trajectory, we should be able to see a significant improvement. I looked at the figures, and even this morning, at the moment, we've got 16 patients on our books waiting for an appointment, which is unheard of in terms of where we were before. Still 16
it's
too
much
many.
less.
Still too many. Yeah,
but
much
very
less.
Reduced, very reduced.
But very reduced, but based on criteria, selection criteria, efficiencies and all that. But if we do need extra manpower, we will invest in
But
that.
can I just comment on that? Because for many, many, many years, we were told, the public was told that we had a full complement. And, my view always was, well, if we have a full complement, but people are having to wait so long, then there needs to be more people. And now you're saying that we have 7 instead of the 5. Yeah?
I wouldn't disagree with that. I mean, a full complement means nothing if it's not the right complement.
Yeah.
So you need to look at the need, the requirement. Sometimes it's a case of making sure the criteria of where each patient goes to what healthcare provider is the right one.
Picking up on Conchita's point about assisted living, we have a small model in Gibraltar already in Sampits, where we have at the moment, I think it's 4 service users who are actually being taken care of, and the reports that we are getting from relatives and from patients
that it's
themselves,
the best they've ever been.
It's not that Sampits is ideal. There's a lot of things that we're doing, physical aspects of it, but they've got activities. They go out every day. They go shopping. They have a small budget, and issues, for example, was before with CMHT have improved. So there's a mental health input from that as well. This kind of model is something that government should be really looking at, and it's not just a ward somewhere or a house somewhere. It's just because people will need different types of assisted living as they move on, because they will continue to have their mental health issues until old age.